Hi, my name is Ana Maria Amador, and this is a public service announcement on trichomoniasis, also known as Trich. I know that as most college students, the last thing that comes to mind when we hear the word sex is sexually transmitted disease. But it's a fact that an STD can be acquired if safe sex is not practiced. Today, I will be talking about one of many STDs that exist. Trichomoniasis is a sexually transmitted disease caused by a protozoan parasite known as Trichomonas vaginalis. This infection affects both women and men, and the symptoms may vary between each person. Only around 30% of people who are infected with this parasite know that they have it. In the whole United States, around 3.7 million people are infected. But the good thing is that trichomoniasis is the most curable STD. To become infected with trichomoniasis, the parasite must be passed from an infected person to an uninfected person during sexual intercourse. In women, this infection occurs in the lower genital tract, the vagina, the vulva, or the urethra. In men, it occurs inside of the penis, the urethra. The parasite must be transmitted or can be transmitted from the penis to the vagina to penis, and even vagina to vagina. It is not common for this parasite to live anywhere else in the body, such as places like hands, mouth, or even the anus. Just because you don't develop any symptoms doesn't mean that you can't infect other people. Symptoms actually tend to show up more in women than in men. "70% of people with this infection do not develop any symptoms, but when symptoms do show up, they can range from mild to severe. Symptoms in men include burning after urination or ejaculation, itching or irritation inside of the penis, and discharge from the penis. Symptoms in women are very similar. They can experience discomfort with urination, itching, burning, redness of the genitals, and discharge with a strong smell. It is not recommended for both men and women to have sexual intercourse while developing these symptoms because it's probably really painful to have sex while having the symptoms not being treated, without being treated. Without treatment, the infection can last for months and even years. You can start getting symptoms around 5 to 28 days after being infected, but for some people, they can show up later than that. Symptoms usually come and go, so you never know when it has gone completely unless you're treated by a doctor. Trichomoniasis cannot be diagnosed alone. You must go to the doctor to know if you're infected with trichomoniasis. What the doctor might do would just be a few tests, such as a pap smear or a wet prep, which is an examination of the discharge, just to see if you do have the parasite. Men are usually a little bit harder to be diagnosed just because they rarely show any symptoms, so they start getting treated after their sexual partner has been diagnosed. The treatment is very simple. It's just a single dose of an oral antibiotic. And just like whenever you take any antibiotic, you should not drink alcohol while taking it or 48 hours after taking it, because you might get unpleasant side effects such as vomiting or nausea. Just because you get treated does not mean you cannot get it again. Actually, 1 in 5 people get reinfected just within a few months of being treated. And long-term infection can actually cause complications later on, especially for pregnant mothers. Trichomoniasis for pregnant women, trichomoniasis has been linked with premature birth. If not treated, it can increase the risk of you getting another STD. The best way to prevent trichomoniasis and any other sexual transmitted disease would be to use a condom correctly every time. If you use a condom every time that you have sex, you reduce your chances of getting infected. But everybody knows that that doesn't always work. So the complete best way would be abstinence. If if you are having sexual relationships, just make sure you know who your partner is. You know that your partner is healthy. I think the most important thing is to be able to talk to them. And if you are infected with any type of sexual transmitted infection, then it's important to let them know. There are many places in Lafayette that you can find online that you can go get tested. There are even some places where you can go test it for free. I actually think that at UL here in Lafayette, you can just go to the clinic on campus and you can get tested. It is very important that everybody, if you just see something wrong, something not normal with your body, it's very important that you go to the doctor immediately to see what's going on.